Chris Bird. I'm a member of the COVID-19 task force, and I'll be delivering both the Nueces County COVID report as well as the task force report for this week. Before I get started, we found out late today that the governor issued an order where bars could open up to 50% in counties where the percentage of hospitalized patients with COVID is below 15%. We here in the Coastal Bend area, as far as I know from the data, we're all below 15%, so that applies to the whole Coastal Bend area. I've also been made aware that an official statement will be forthcoming from Judge Canales. With that, we'll get into today's new numbers. So over the past 2 weeks, we had this one spike of 57 cases, but last week we reminded you all that you shouldn't focus in on any one day, and you want to look at the long-term average. And overall, we're getting to see more and more single-digit days for new cases. For today, we have 12 new cases in the Coastal Bend area. These are all real cases, new cases that apply to today. And none of these 12 are backlogged. Overall, you can see that our donut chart has a whole lot of recoveries. Most of the donut is recovered, and that's this orange section with 20,048 people. There's 274 active cases, and unfortunately, we've had 2 more additional deaths that are reported today, so that brings us up to 423 fatalities in the Coastal Bend from COVID-19. If we look at the hospitalizations, you can see that it's level. It's no longer going down. Over the past 2 weeks, the total number of people in the hospital with COVID-19 has remained level. 74 today. It was 78 2 weeks ago, and when you go in the middle here, you can find numbers above and below that 74. Looking at the number of COVID-19 positive ICU patients, that's also remained level. Today we're at 33, and you can see this value has hovered around 30 on average for the past 2 weeks. Looking at our cumulative number of fatalities over the whole pandemic, again, we had 2 new fatalities today. That brings us up to 423 total in Nueces County. You can see, though, that this pattern is getting less steep, so the accumulation of fatalities is slowing down, and that's a positive development. If we look at the whole pandemic here, these bars represent the number of cases per day that we've observed, and the red line is a 7-day average. And you can see that when the outbreak occurred in the early summer, we rapidly increased to the peak of the outbreak in about a month, and then it's taken several months to come down off that peak. So that's that long right tail, or that long trail down from the peak of an outbreak that we've been on, and we've been relatively low, approximately 13 new cases per day, I think is the number that I was told on average. And the last plot here, I kind of think of this one as the frosting. So these yellow spots on the graph, those are the backlogged cases, so ones that we found out about way later. The blue ones were reported at the time when we were on those dates, and then we've been getting these data backlog drops where we then backlog them. So today we got an additional 6 backlog cases that date back to June. So that's kind of even before the outbreak really took off, and they're not affecting anything in the recent time. If you want to take anything from this plot, it's that most of the frosting on our graph here is well back in the outbreak period, and we don't really see it filling in so much since the outbreak subsided. So hopefully that continues, and there's not a number of cases out there that we haven't found out about yet. So that is the update for Nueces County, and now I'm going to move into the task force report. So this is the report for the COVID task force. It's for the whole Coastal Bend, not just for Nueces County. We have 2 objectives on the task force. The first is to address public concerns and questions about COVID-19 and the interventions or rolling back of interventions that's taking place, as well as helping to enable evidence-based decision-making. For example, one of the biggest questions I got asked over the past week is, how are we going to handle schools going back to more face-to-face, along with some districts talking about potentially decreasing social distancing or removing masks. And the answer that I consistently have with that is that, well, the evidence shows that masks are preventing the transmission of COVID-19. And if you want to have more face-to-face schooling, the face coverings are something that's pretty important, and the social distancing, those two things combined can really help to make that happen. So interventions and opening Texas actions that are happening. If you're above the age of 65, this is in the governor's order that I read earlier today, you should stay at home if you can, and if people in your household have been out and about in the past 14 days, you should try to maintain appropriate distancing from them. People are encouraged to continue to social distance at 6 feet. The reason why it's 6 feet is that's the distance at which particles that are expelled from your mouth that you can see or from your nose, they fall to the ground within 6 feet. So that's where that 6 feet comes from. Now we know also that the virus is aerosolized. It's in the air, it can be transmitted like that, and those particles, you can't see the virus is transmitted in them, and they travel farther than 6 feet. So you want to be at least 6 feet away, but really you want to be farther, have a face covering, and that will help a lot. That's why those regulations are in place. You want to self-isolate when you're symptomatic or when you come into contact with somebody who tested positive for COVID-19 until you confirm that you don't yourself have COVID-19. I think we saw what happens last week at the Rose Garden in the White House, what happens when nobody's wearing masks and somebody gets COVID and it gets transmitted very quickly. COVID is around, it's not gone, and once you let it in, it can quickly spread. School restrictions, we're backing off of those. I think we're at 50% plus face-to-face, and it's kind of up to parents in some districts at this point whether their children go face-to-face. Other school districts are doing a rotation. So there's a variety of different things that are happening. And then Open Texas, so we started with Open Texas Phase 1, 2, and 3. Phase 3 was too much. That's where we had the outbreak triggered, was in the Open Texas Phase 3. The first time around, we rolled back to Phase 2, then to 1.5. We stayed at 1.5 for about 3 months, and now we've opened back up to Phase 3 levels. And last week I called it Phase 3. This week, with the new order, it's really Phase 3, with the bars back up to the same level of openness as they were during the Open Texas Phase 3 in June. So that's where we're at in terms of regulations. Where are we at in terms of transmission? So for the past 2.5, 3 months, we've been talking about a transmission rate of 0.9. Today, it looks like our transmission rate, our best estimate is 1, so that's higher than we've been predicting for the past several weeks and months. This graphic here of Texas in the upper right-hand corner, it's color-coded by the probability that the transmission rate is above 1, increasing, or below 1, decreasing. And so if you see red, it means in those counties, COVID-19 is likely spreading. And if you see blue, it's likely not spreading. And if it's white, COVID-19 is likely holding at about the same level. And that kind of rings true. We in the Coastal Bend, we're right here. We're in the white zone. We're 50-50, whether we're increasing or decreasing. And that kind of rings true with the data with the number of cases and the hospitalizations. The graphic over here shows how the transmission rate has changed through time. We're right here today, right around 1.0, and transmission rate, once again, is the probability that if you get COVID, you transmit it to another person. So if it's a 1, you transmit it to 1 additional person on average if you get COVID. The total cumulative number of confirmed cases in the Coastal Bend of COVID-19 stands right now at 23,761. Remember, these are confirmed cases, so we don't include the probable cases in these counts because the state DSHS indicates that they only want to report the confirmed cases. So to be able to compare our numbers from the Coastal Bend and even compare the numbers from Nueces County to the other counties in the Coastal Bend, we need to use these confirmed cases. And what makes a case confirmed is if it is confirmed with the PCR test, which is the gold standard. And essentially the PCR test detects the genetic material of the virus being present. We're at 22,271 recoveries and only 821 active cases. You can see these active cases, they've been holding fairly steady over the past several weeks at this point, maybe 2.5 weeks. There's an ever so slight decline. Last week, this estimate was at about 1,000. And I do want to emphasize that these numbers with active cases and recoveries, they are estimates. There's been so many cases at this point that it's really impossible to follow up every single person who's gotten COVID-19 and have an accurate count from every county in the state of Texas. So these are algorithmically calculated based upon DSHS's own calculations. Ultimately, that these cases are leveling off, it's something that is of a little bit of concern. We'd like it to go down more. We'd like to have less than 821 active cases. In terms of our ranking, where do we rank? We're moving up a little bit, but I wouldn't pay too much attention to that. In terms of our average cases per capita over the past week, we're very low. We're in the lower echelon of all of the trauma service areas across Texas, and hopefully we continue to stay there. So being ranked low is good. It means a small number of new cases per day per 100,000 people. But let's kind of step back, and we haven't shown this graph in a while. Let's compare ourselves to other counties and other parts of Texas. In this case, these are public health regions, and so there are these different areas around Texas. Each one is a public health region. When you look at this graphic, what you can see is that the majority of the public health regions are having, or at least a few of them are having an increasing trend, especially the ones to the north. So Amarillo, El Paso, these areas of Texas that are farther to the north, there's been a long and sustained increase in the COVID-19 cases, and these are new cases per day per capita. Also in Dallas. So those are 3 of our 4 northernmost public health regions in Texas. So this kind of looks like, for any fans of the Game of Thrones, this looks like winter is coming. We're seeing this pattern where up in the north, we're starting to see more cases rise. And if you look across the country, you'll see that pattern too on the national news, where they'll show the northernmost states are the ones where the cases are rising the most right now. For us in South Texas, we're kind of leveled off along with Longview and Austin and a few other public health regions. And right now, we're pretty low. But it looks like with the seasons changing that maybe this could start to increase, especially with the changes in the policies that are occurring. Moving into a little bit of a zoomed in view of South Texas. So we're looking at just the metro counties. And again, we haven't shown this graphic in a while, so we thought it was time to bring it back. And all of the metro counties in southern Texas have a declining or level trend right now in the new cases per day. So that's a good development, and we want to watch this and see what happens moving forward. Okay, and then in the coastal bend, and there's not a lot of clarity that comes from looking at this plot. I kind of call this pattern confused, but we have some counties in the coastal bend that are increasing, like B. It's probably related to the correctional facility that's there in B County. Duval increasing slightly. Other counties dropping off, Nueces, Clayburgh. But if you look at this overall 2-week pattern, what you'll see is that there is kind of this decline and then maybe a little bit of a jump up in the number of cases over the past week and a half. So that's something that we want to look at. We kind of like areas like here around September 27th, between September 25th and September 27th, rather than what's happening after September 27th. Okay, moving on to our percent positive tests. Overall, over the whole pandemic, these numbers haven't changed, and the reason why these numbers up here aren't going to change is because there's not a lot of cases right now, and these are based upon all the tests that were conducted that we have the results from and all the people that tested positive, and we're not going to be changing these numbers too much. So over the whole pandemic, for all the testing we've done, approximately 38% of all people were positive for COVID-19. But if we look at the trend today, so we follow that trend up and down. For the local public health department testing, it's at 10% positives. And here we know all the people that tested positive and all the people that tested negative. So that's a very reliable number. For the mobile testing stations, it's the same situation there. It's about 6.9% of people are testing positive. And overall, this includes for testing sources like CVS and other testing sources where we don't get all the negative tests back, it's at 8.2% positive. So somewhere between 6.9 and 10%. The important thing to notice is that if we compare back to late May, on the left side of your screens, you'll see that we were much lower than we are right now in terms of the proportion of people testing positive. And so we're not down to where we were before this outbreak in terms of that metric. And we're really not to that level for any of the metrics that we're showing. Moving on to hospitalizations, we're ranked right in the middle of all the trauma service areas in the state for the rate of the number of people hospitalized per capita per day. This has been a slow decline, and really over the past week or two, it's leveled off and it's not really declining at all. I hope that in the next 7 days, we'll start to see a little bit more of a decline. Here, we're showing our simulation projection. In the green simulation, this is the same one that I showed last week, and basically the same projection that I've been showing since the middle of July. We haven't changed the parameters in it yet. The red points represent the number of people that are in the hospital. The green represents what the model predicts if the transmission rate has been 0.9 since July 10th. And what you can see is for the first time, we're starting to get a noticeable deviation in the number of people that are hospitalized from what is projected under the model. So this fits a little bit with our data earlier where a model predicted that the transmission rate has increased from 0.8 to 0.9 up to 1. And indeed, when we look at the number of people in the hospital, it's coming out above what the model would have predicted if the transmission rate was 0.9. So this is something that we're going to keep an eye on right now in terms of the percent of people that are in the hospital that are COVID positive. Of all the adults, we're at 9.8%. So we're well below that 15% threshold that would trigger businesses closing down to 50%, bars having to close down all the way unless they have 51% of their sales being from food rather than alcohol. So we have about a 5% cushion right now before that trigger. One other thing that I'll emphasize here, because it's the last time I'm going to talk about it, it's not just when we hit 15% of people in the hospital being COVID positive that things shut down. It has to be 15% for 7 days in a row. And if that's not the case, then the law doesn't trigger closures. So we'll let you know if we're getting anywhere near that, but for now, it doesn't look like it. Moving on to the ICUs, and this is where we're really concerned about hospitalizations because this is the part of the hospital, or the hospitals in the coastal bend that were really stretched. As far as I know, there's still FEMA nurses here that are assisting with the duties in the hospitals. And as of today, there are 26 people in the coastal bend ICUs with COVID-19. That's down from the number that we had last week. If you look at these bars here really closely, you'll notice that really in the past week to week and a half, there hasn't been any change in the number of people in the ICU. It looks very similar to the graphic that we saw for Nueces County. This is for the whole coastal bend. When you look up here, you can see that we're not back down yet to the place where this blue dashed line is, where that represents normal, if you will. So before we had the outbreak, the blue dashed line represents about how many people on average that were in our ICUs. So that represents the amount of work that there is for our doctors and nurses to do in the ICUs. And you can see for us, we're having all these jumps well above the blue line. It doesn't look like it did before yet. However, we are trending in the right direction. If we draw a fit line through this data, we can see that we are slowly but surely progressing towards the level of ICU activity that was present before the outbreak. So hopefully this trend continues. Moving on to fatalities. Again, we're middle ranked, but we're well below Paris, where for the past 2 weeks, Paris has been fairly highly ranked for the number of fatalities. In the coastal bend, we're in the middle of the pack, but well lower than we were at the peak. And the 2 fatalities today in Nueces County is kind of an aberration for the average that we've been seeing recently. In terms of the total number of fatalities in the coastal bend, we're up to 669. This number is from yesterday. It doesn't include the 2 from Nueces County or any additional fatalities that occurred today. Also, it's important to note that these numbers are from the state. So what that means is that the state takes all the death certificates after we have a report of new fatalities for Nueces County. They don't end up in the state's numbers for up to 2 weeks. So these 669 fatalities represent the counts from the death certificates, and the last 14 days are still being processed. That's why we draw this box to represent that they're not all counted yet. However, your eyes don't deceive you. There is a leveling off that's occurring, and we are getting fewer and fewer fatalities that are accumulating each day. The projected number of fatalities versus the actual, the red points, again, those are the actual number of fatalities that are occurring per day in the coastal bend. The blue ribbon is the model that's fit through it, and then this kind of purple part of the ribbon all the way to the right represents the last 14 days where the death certificates are still being counted and where the model is projecting that the points will fall out on average. It shows a slow decline and really a leveling off at this point in the number of fatalities. And what we'd really like to see is have it go to where it was back in the beginning of June. If you look at the left side of the graph at the 6-1, there was 0 day after day after day. We're not there yet. And so hopefully we can get there. The last part of the presentation focuses on cell phone data. And the reason why we look at the cell phone data is because it gives us a little bit of a glimpse of what's happening now. And the reason why that matters is because by the time somebody becomes a statistic in terms of a case, that's really, they might have been exposed to the virus 2 weeks ago, a week and a half to 2 weeks ago. So the things that we see in the cell phone data today are affecting the numbers that we're going to see 2 weeks from now for cases, hospitalizations 3 weeks from now, and fatalities maybe a month from now. So the encounter rate is something we've been following. An encounter rate that we're calculating here depends on 2 devices coming near each other for a given amount of time. If you're in the house together with your family, that doesn't count. If you're together for too long, it doesn't count. Only for chance encounters that occur for a brief period of time, under an hour, get counted. If you're skeptical about whether this works or not, you can see during Hurricane Hannah, it was one of the lowest amounts of encounters that we've seen. However, since the beginning of school, there's been this remarkable decline in the encounter rate that I have no other explanation for it other than that when children are doing remote schooling, they have to stay at home, a parent is staying at home, it's leading to less encounters that are occurring in the community. So remote classes started, and we started to see a decline in that encounter rate, lower than anything we've seen since even before the beginning of the last outbreak. You can see we're way down here. We're in Hurricane Hannah territories Monday through Thursday in terms of the amount of encounters that we're having. You can see, though, that since Open Texas Phase 3 occurred, so this last dashed line, that also coincided with schools going to up to 50% face-to-face. We do see this number starting to curve up slightly, and so we will track that. But right now, the encounters have almost never looked better for us, except during the stay-at-home. So that may be one positive aspect of classes being remote, that it seems to be related to a decrease in the encounter rate. And there's one more calibration point for you to see. Memorial Day weekend was way up there at 150% of normal. And Labor Day weekend, we kind of learned our lesson by then. We're only at 75% of normal on an average day in February. For foot traffic, you can see that the foot traffic in the K through 12 schools is increasing. I color-coded these blue this time because these are specific to the K through 12 category. Remote classes, 25% face-to-face, 50% face-to-face. We can see the response where when we went to 25% face-to-face, we started to see an uptick, and we're seeing a continued increase through the 50% face-to-face. These numbers are averages over a week, so next week we'll get another data point to stick on there. Universities and junior colleges, they're level because their policies are set in place and they're not really going to change in the middle of the semester. So classes that started remotely, finished remotely at Del Mar or at TAMU-CC. Going on to essential and non-essential gatherings, there's been a decline in essential gatherings, so that's going to the home improvement store, grocery stores, that's slowly declining. Malls, restaurants, and bars have been roughly level, and the movies have come up from where they were, but recently a slight decline. Maybe there's not as many good movies that are available right now. I'm not sure why that's happening. But nonetheless, essentially, we don't see a whole lot of information here. It's going to tell us the next outbreak is coming from here. Lastly, leaving home is increasing. And actually, this title is erroneous. I'm sorry about that. The leaving home is leveling off, and the distance traveled is increasing. This is a really strong increase that's occurring. It seems to coincide exactly with schools going to 50% face-to-face. So this is most likely being driven by parents that are able, first they're probably taking their kids to school, as well as they may do more errands and things during the day when their kids are not in the house doing remote schooling. So in summary, the transmission rate may be rising. We're at 1.0. There's a departure from predicted hospitalizations from what's been simulated. So all of that points to a higher transmission rate than we've had. And these hospitalizations, they seem to be leveling. The new cases remain low locally, but they're increasing in North Texas. So this is something we want to watch. Do we see these increasing patterns of cases creep farther down south to where we are in the future? School regulations are strongly correlated with our patterns of behavior in the cell phone metrics. And it seems that remote schooling has triggered a decline in the amount of encounters that are occurring in terms of cell phones coming near each other, which can result in potentially less potential transmission. So I see that as the silver lining of remote schooling. Remember, I'm a professor, so I understand the value of an education. We definitely want to have kids eventually be all back to school face-to-face. But until we can do that safely, we have to think about the ramifications that could have. And lastly, as occupancies rise with Open Texas, as weather cools, as we move into the winter, face coverings and social distancing and hygiene, this is what we have to protect ourselves from another outbreak of COVID-19. Last week I showed projections based upon the number of people that have been infected thus far, which we estimate to be somewhere between 7 and 20% of the people in the coastal bend. We're nowhere near herd immunity, and under the current regulations of we can turn off the faucet, if you will, of transmission. When we hit 15% hospitalizations, this will not stop an outbreak from occurring that's of a magnitude similar to what we went through in the summer. So wearing face coverings, social distancing, these are the tools that we have at our disposal to prevent another COVID outbreak. So it's, you're strongly encouraged to continue wearing your face mask and social distance at least 6 feet. And with that, we'll go to a translation.
El doctor Chris Baird dio ambos reportes. Primero indicó que el gobernador del estado dio una orden en donde los bares podrán operar al 50% de su capacidad en condados que cuentan con menos del 15% del área de servicio en sus hospitalizaciones por COVID-19 y por al menos 7 días consecutivos. Esa orden no será vigente sino hasta el 14 de octubre y solamente una vez que sea adoptada por el gobierno local. En este caso, la juez Canales debe de adoptar ese cambio. En cuanto a las cifras actuales, el día de hoy se reportan 12 casos confirmados por el coronavirus. 6 de estos casos provienen del estado. Estos casos datan desde el mes de junio. El total de casos de hoy van a ser 18. 74 personas continúan en el hospital, 33 están en la unidad de cuidados intensivos. El día de hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 423 personas. De acuerdo al estudio por el equipo especial de la Universidad Texas A&M, estos reportes son en el área de la costa, la cual cuenta con 12 condados. Hasta la fecha se reporta un total de 22,761 casos positivos, 22,271 recuperaciones y 821 casos aún se encuentran activos. Algunos condados en el área han reportado declines como en Nueces, pero los condados de Bee y Duval registran aumento en los casos positivos. En cuanto a las pruebas, el 38% del total de pruebas ha resultado positiva. En cuanto a casos positivos del área de la costa, continúa declinando. En cuanto a hospitalizaciones, estamos en el medio de la gráfica y en cuanto a fallecimientos, somos el número 11. Hasta el momento son 669 las personas que han fallecido debido al virus. Actualmente 97 personas se encuentran hospitalizadas con el virus en el área de la costa. De esas hospitalizaciones, 26 pacientes están en la unidad de cuidados intensivos. Los encuentros entre personas en cuanto a los posicionadores globales o GPS también han disminuido, posiblemente porque muchas de las clases aún continúan de manera remota, aunque los reportes de la gente que sale de su casa continúa aumentando. A la fecha se reporta que la tasa de transmisión del virus es del 1%, lo que significa que una persona tiene el 10% de posibilidad de infectar a otra.
Thank you. All right, with that, I think we'll take some questions from Facebook. Nope, no questions from Facebook, I'm being told. So I think that's it. Thank you, everybody, and have a good evening.